अरे पेलेग्रा तो तब होगा जब ट्रिप्टोफैन की डेफिशिएंसी होगी, तो मतलब सेरोटोनिन कम होगा। सेरोटोनिन ज्यादा होता है किसमें? कार्सिनोइड सिंड्रोम में, तो पेलेग्रा तो आएगा नहीं ना ज्यादा। क्या आता है? आप उसमें ऑक्टियोट्राइड भी देते हो ना, और ऑक्टियोट्राइड किसमें देते हैं? क्रीटरी डायरिया में भी देते हैं, तो पेशेंट की कॉम्प्लिकेशन प्रेजेंटेशन क्या होगी? डायरिया। समझ आ गया? ऑक्टियोट्राइड इज अ विच क्लास ऑफ ड्रग? ऑक्टियोट्राइड इज अ विच क्लास ऑफ ड्रग? सोमैटोस्टैटिन एनालॉग। बोसेंटन कौन सा ड्रग है? क्लास का। वायरल का है बोसेंटन। व्हाट इज द ड्रग ऑफ चॉइस ऑफ अ पेशेंट हैविंग ब्रोंकियोलाइटिस कॉज बाय आर एस वी, है ना? तो ड्रग ऑफ चॉइस क्या दोगे? कौन सा वाला? राइट स्प्रे दो, कौन सा वाला? या हाँ, रिबावरिन। वेरी गुड। चलो, लेट्स कम बैक टू द सेशन गाइस, बहुत हो गया। बाद में और एक रैपिड फायर खेलते हैं। तब हम खेलेंगे किस सब्जेक्ट का? कौन सा नहीं आता है तुम लोगों को? पीएसएम? अभी पीएसएम तो बहुत पढ़ाऊंगा। फिजियो मुझे खुद नहीं आता है। माइक क्यों? डॉक्टर विकास पढ़ाते हैं माइक्रो। ओह, डॉक्टर विकास अच्छी माइक्रो है, चलो पढ़ो। यस, इनफ, यू रिवाइज द सेम नोट्स कसम से। यस, व्हाट, वी आर नॉट सीइंग एनीथिंग। चलो, यू रिवाइज द सेम कंटेंट, ट्रस्ट मी, नोट्स आर ऑल सेम। मल्टीपल टाइम्स रिवाइज करोगे, दैट्स वेरी नाइस। ड्यूरिंग माई टाइम आई स्टडी माइक्रोबायोलॉजी फ्रॉम द सेम नोट्स। ड्यूरिंग माई टाइम आई स्टडीड माइक्रोबायोलॉजी फ्रॉम द सेम नोट्स। Okay, you have to solve more and more questions. Okay, teacher can only give you 50 to 60%. Rest 40% you have to start by yourself. वो आपको पुश करना है खुद को, ठीक है ना? कोई आपके पास एक सोर्स है, बट इस सोर्स को यूज करना क्वेश्चंस में, एमसीक्यूज में किसका काम है? आपका काम है। और देखो, नाउ इफ देयर आर 50 students, 30 students in the classroom, teacher is same, workbook is same, concepts are same, then why only 10% people will pass? That means 3 students only. Why? If everything is same, teacher is same, content, the thing is you also have to put on the efforts. Okay, you also have to integrate, आपको यूज करना कि ये वाला पॉइंट क्यों नहीं है, ये वाला पॉइंट क्यों नहीं है, ये वाला पॉइंट क्यों ना। ऑल द फैकल्टीज, लाइक हर एक जगह जाओ, एवरी टीचर वांट्स द स्टूडेंट टू पास द एग्जाम, नो मैटर व्हाट। और हमेशा वो अपना बेस्ट ही देता है। अब गलत तो पढ़ाएगा नहीं। यस, देयर कैन बी कंट्रोवर्शियल क्वेश्चन, समटाइम्स वन क्वेश्चन अप एंड डाउन, बट एट द टाइम समटाइम्स कंटेंट इज व्हाट स्पीक्स। और अगर आपको छोटे कंटेंट में बहुत काम हो रहा है, गो फॉर दैट। चलो, एनीवे, फिजिकल क्वालिटी ऑफ लाइफ इंडेक्स includes following parameters except, yes, physical quality of the life includes following parameters except, what is your answer? D, life expectancy at birth. Okay, now let's discuss about the physical quality of life index and human development index. These are the indexes that will tell us about the quality of life. And in the recent NEET PG question, morning में क्या पूछा? PQLI. Evening में क्या पूछा? HDI. So very repeated questions. Okay, now if we talk about the components of a PQLI, we have first one, life expectancy. We have life expectancy at 1 year of age. We have life expectancy at 1 year of age. Second is going to be literacy rate. And third one is going to be infant mortality rate. What are the three components? So it's life expectancy at 1 year of age, it's literacy rate or infant mortality rate. Okay, now the range is from 0 to 100. Range is from 0 to 100. Okay, now if I talk about HDI, life expectancy at birth, we have life expectancy at birth. second one is going to be knowledge, and third one is going to be income. Third one is going to be income. Okay, so life expectancy at birth, we have knowledge and we have income. Okay, and the range is 0 to 1. Range is 0 to 1. Now, NEET PG में question कैसे पूछा था? They gave these 4 to 5 components. Are you getting my point? They gave life expectancy at birth, life expectancy at 1 year of age, income, knowledge, and they mentioned out of which of the following will be correct about HDI. Then options में था 1, 3, 4, 2, 3, 1, 1, 4, 2. So you have to find those three components that are going with what? HDI. Okay. So life expectancy at 1 year age को हटा के all the given options were about going to the HDI. PQLI में आता है 1 year of age and rest is going to the HDI. Is that clear? But FMGs में कैसे पूछते हैं? Out of which of the following is not a component? Okay. So अब NEET PG हो FMG हो, level is same. Okay. हमारा वाला थोड़ा difficulty होता है. So expect that question will come from which? From quality of life indicators. Is that clear? Now we have some other names for what? Literacy rate. Literacy rate synonym for literacy rate. Now, either literacy rate can be mentioned with the name as knowledge or mean year of schooling or education index. Or we have which index, guys? Education index. So that's all about what? PQLI and HDI. PQLI and HDI. Okay, then we have other indexes as well, which will tell us about the quality of life, human poverty index and all, human suffering index. But main two important is what? PQLI and HDI. Remember the components, don't get what? वो confused नहीं होना. At 1 year of age, at birth. And knowledge, literacy rate, mean year of schooling, that is all same. Okay. Next one. आशा, पहली बात, कौन है? कौन है? Working during her visit village in a Bihar, came across a patient complaining of fever, weight loss for how many months? 3 months. Skin was dark. Abdomen, she performed a test called as RK39 dipstick test, which turned to be positive. What is the diagnosis? Leishmaniasis. Now, first question में ही question एक. Who is going for the surveillance of leishmaniasis? Asha. पूरा बड़ा आशा लिखा है. Who is going? Asha. Now, surveillance. What is surveillance? We have types. We have active, we have passive, we have sentinel. Active is health worker is going to home and checking the disease. That is active surveillance. Passive, disease people is going to the hospital and checking the treatment. That is going to be passive. And sentinel, exclusively for the sexually transmitted diseases. Is that clear? So, Asha कहाँ जाती है? Gartugar for which disease? Kala azar leishmaniasis. Now, if we talk about this leishmaniasis, we have an agent for leishmaniasis. What is the agent? L. Donovani. For which leishmaniasis? Visceral leishmaniasis, right? But visceral leishmaniasis is what we call a Kala azar. Okay. So, agent L. Donovani. Which leishmaniasis? Visceral leishmaniasis. Kala azar. मैं पूरा लिखता हूँ. Kala azar. Okay. Second one, we have L. tropica. Which leishmaniasis? Cutaneous leishmaniasis. Then we have L. brasilens. Very good. That is mucocutaneous leishmaniasis. That's going to be your mucocutaneous leishmaniasis. Is that clear? Yes. Next, what is the vector? Sandfly. Microbiology NEET PG question, recall. Vector for leishmaniasis. What is your answer? Sandfly. But उन्होंने sandfly नहीं लिखा था. उन्होंने लिखा था Phlebotomous fly. Is that clear? One more question हो गया, ठीक है? उसके बाद reservoir. Wild animals. Okay, now the diagnosis. What is the test we have? RK39 dipstick test. What are the bodies? Intracytoplasmic inclusion bodies. Uh, LD bodies, simple, very good. This is an initial test for the diagnosis. Which test, bacho? RK initial test for diagnosis is going to be RK39 dipstick test. Okay. Then the confirmatory test that we have. Yes, LD bodies. If we check the LD bodies, intracytoplasmic inclusion bodies, the answer is going to be Leishmaniasis is a confirmatory test. So, right, LD bodies. We have LD bodies called as Leishmania, Donomani bodies, called as Leishmania, Donomani bodies. And this is going to be a confirmatory test. This is going to be a confirmatory test. Okay. And the third one is going to be Leishmania test. Third one is going to be Leishmania test. Is the diagnosis test? No, sir. Leishmania test is it's like a Mentox test, है ना? Lepra test. It tells us about the immune status of a patient. It tells us about immune status of patient. Okay. What is the drug of choice? L-amphotericin B. Lamb is also drug of choice for mucormycosis and cryptococcal meningitis. Okay, and to control the vector, we have an insecticide, dichloro diphenyl trichloroethane, DDT याद रखो, ठीक है ना? Then post kala dermal leishmaniasis, we give a drug called as miltefosine. क्या देते हैं? Miltefosine. Is that clear? Yes. Phlebotomous fly, sand fly is a question. RK39 dipstick is a question, and liposomal amphotericin B is a question. ठीक है? ये तीन क्वेश्चन पक्का पक्का याद रखना. ठीक है? Now either the examiner will ask the test. Either examiner will ask the test हुआ था. What is the diagnosis? Either he will give the clinical picture and ask the drug. Is that clear? चलो. The upper class score for Kuppuswamy scale is, yes, 26 to 29. So what is Kuppuswamy scale? It is a scale which tells us about socio-economic status of which areas? Urban areas. Parameters of income, occupation and education. They will ask out of which of the following is not housing option में होगा. So income, occupation and education. Now if we talk about the upper class, what is the score? Total score is 29. Upper class is 26 to 29. Upper middle is 16 to 25. Middle lower is 11 to 15. Lower upper is 5 to 10. And lower is 0 to 5. Yeah. 26 to 29 will be upper class. Is that clear? That's the which scale? Kuppuswamy scale. Now, most repeated question in your exams. Which of the following is the correct dosing schedule according to the given program logo? According to the given program logo. What is your answer? C. First of all, this was this was launched in order to do what? In order to prevent the incidence of in order to prevent the incidence of malaria. Sorry, in order to prevent the incidence of anemia. And it was said we will decrease by 3% every year. And this, as per this logo, they initiated 6 beneficiaries, a particular age group and the pregnancy and lactation people. Okay. Now, as per this logo, if the question always come, you will answer what is the folic acid dosage and what is iron dosage. But अगर इसके बाहर पूछ रहा है, for example, you have a patient, you are coming to me, you have anemia. How much iron I will give to the patient having anemia? Normally pregnancy में कितना देंगे? 100 mg. अगर mild to moderate anemia है तो 200 mg. But as per anemia मुक्त भारत 60 mg. So always pay attention whether they are asking as per what? As per the AMB, anemia mukt Bharat, or as per the, is that clear? So you have to see whether they are asking as per the anemia mukt Bharat or as per the normal condition. If a patient is coming to you, now patient is pregnant, how much folic acid you will give normally? 400 micrograms. But as per anemia mukt Bharat, 500 micrograms. ठीक है ना? If a patient is coming to you with a folic acid deficiency, how much you will give? 1 mg per day. तो कितना देते हैं? 1 mg per day. Now, if a patient is coming with a history of neural tube defects, 4 mg or 4000 micrograms. If a patient have a skill cell disease, 5 mg देते हैं. तो कितना देते हैं? 5. So for you, you will just remember, norm, sir, patient is coming, AMB की बात नहीं करता हूं मैं, normally. Folic acid कितना दोगे? Normally 400. History of neural tube defect 4000 micrograms. As per AMB 500. Is that clear? Iron normally 100. Patient having a mild to moderate anemia 200. But as per anemia Mukt Bharat 60 mg. Is that clear? Now this scheme was launched in order to decrease incidence of anemia, and they will say they decrease by 3% per year. Is that clear? Now we have a 6 into 6 into 6 strategy in anemia Mukt Bharat. 6 interventions, 6 institutional mechanism, and 6 beneficiaries. Okay? After that, remember the dosage of this anemia Mukt Bharat as per the age group. If I talk about 6 months to 5 years, 6 months to 5 years, how much iron you will give? 60 mg, 20 mg, sorry. How much iron you will give? 20 mg. And how much folic acid you will give? 100 micrograms. Now tell me, my dear students, which worm causes iron deficiency anemia? Which worm causes iron deficiency anemia? Diphyllobrathum latum causes megaloblastic anemia. Hookworm causes iron deficiency anemia. ठीक है ना? That's why in case of a patient, pregnant lady, what are we also doing? Deworming the patient. है ना? With which drug? Albendazole or mebendazole. Albendazole we usually give in the pregnancy. ठीक है ना? Now tell me, अब dates तुम उतना याद मत रखो, तुम ये याद रखो जो मैं बता रहा. हाँ, अब मुझे बताओ, albendazole is also drug of choice in which conditions? Hydrated cyst. बता दो, hydrated cyst is right. और which condition? Albendazole you will give drug of choice. हाँ, वो तो उसी में आ गया ना. What else? Neurocystic cirrhosis. This was the question asked. Image दी थी neurocystic cirrhosis and it was what? Starry Sky. Okay. Ab albendazole hydrated cyst you said. Okay. Tell me about hydrated cyst. We have a pair therapy. PAIR. P stands for puncture. A stands for aspiration. I stands for initiating or injecting scolitical agent. The scolitical agent that we use is the drug which? Albendazole. ये क्या करता है cyst को? Shrink करता है. ठीक है ना? And R for reassurance. Hydrated cyst किससे cause होता है? Echinococcus granulosus. And what is the sign? On lungs, floating lily sign. वैसे water lily sign है ना? Lungs में भी दिखता है, USGP भी दिखता है. Is that clear? Now, if I talk about neurocystic cirrhosis, it's caused by Taenia solium or Taenia saginata, depending upon that. Okay. Now, this Taenia solium, pork and beef, you already know. Tell me, it causes neurocystic cirrhosis and one more condition, teniasis. What is the drug of choice for teniasis? Started with P. Benzodiazepine. Praziquantel. What is the drug? Praziquantel. Is that clear? Hydrated cyst समझ आ गया है ना? Last question. What is the name of the classification used for hydrated cyst? Name of classification used for hydrated cyst. बस नाम बता दो, क्लासिफिकेशन नहीं पूछूंगा. Jabry's classification. Jabry's classification. Jabolis procedure is used done in hydrocele, है ना? Gabry classification or Jabry classification बोलो. This is for which condition? Hydrated cyst. Then as per this classification of second, that is what is mentioned a water lily sign, drooping lily sign. किडनी के साथ ये कौन सा वाला? डुप्लीकेशन ऑफ यूरेटर. वेरी गुड. ड्रूपिंग लिली साइन हो गया. आगे बढ़े. फ्रॉम आयरन वी वेंट टू हुक वर्म, फिर वहां से सारे वर्म्स को रिवाइज किया, ड्रग्स को याद किया. अब वापस आते किस पे? एनीमिया मुक्त भारत. द थिंग इज दिस इज, यू नो दिस इज द थिंग इज, द मोर यू इंटीग्रेट दिस टाइम. अब ऐसा नहीं है यू कैन से सर अभी हमारा पैथो नहीं हुआ है, अभी हमारा मेडिसिन नहीं हुआ है, अभी हमारा रेडियो नहीं हुआ है. जो होना था वो है ना. एंड इफ समथिंग, आर यू एबल टू रिकॉल? रिकॉल हो रहा है ना. सेम थिंग, एग्जामिनर विल गिव यू हाउ मेनी ऑप्शंस? आंसर आपके सामने है ना. बट द मोर यू विल ट्राई टू रिकॉल, कुछ चीजें फिर वहां पे याद आ जाती है. नाउ व्हाट इज द फ्रीक्वेंसी? ट्वाइस अ वीक. व्हाट इज द फ्रीक्वेंसी? ट्वाइस अ वीक. ओके. उसके बाद 6 years to 18 years. How much of iron? 45 mg. How much of folic acid? 400 microgram. And how much you will give? Weekly. After that, remember 10 years to 19 years, 19 years to 49 years, pregnancy and lactation. All we have what? मैं एक साथ ही लिखता हूँ 60 mg. ठीक है ना शॉर्ट में. और सबके लिए फोलिक एसिड कितना है? 500 micrograms. Weekly, daily, daily. Is that clear? Yes. उसके बाद लिखो hookworm causes which deficiency anemia? Iron deficiency anemia. TIBC is increase in which anemia? Iron deficient anemia. अगर decrease होगा anemia of chronic disease, है ना. anemia of chronic disease, है ना. Iron deficiency anemia. Diphyllobothram latum causes which type of anemia? Megaloblastic anemia. Which vitamin causes megaloblastic anemia? B12 and B9. Megaloblastic anemia. Vegetarian people में भी दिखता है due to the B12 they are not having. ठीक है ना. Hookworm and also remember that's why we deworm the patient where? In case of pregnancy. Is that clear? Clear हो गया? Yes. Now let's move to the next question. For a pregnant lady, now why we are giving folic acid in pregnancy? In order to decrease the neural tube defects. Is that clear? Now, in case of a neural tube defect, most common is going to be spina bifida. Spina bifida. The sign in spina bifida is banana sign and lemon sign. कहाँ पे दिखती है? Brain, cerebellum में. Is that clear? The marker to check the neural tube defect, acetylcholinesterase. Acetyl. The other neural tube defect that I discussed yesterday, anencephaly. It is occurs due to the failure of closure of anterior neural pore. On which day? 25th day. What are the two signs? Frog eye sign and triangular face. Mickey mouse. हो गया. ठीक है. आगे बढ़े. And anencephaly is associated with which condition? GDM. Gestation. चलो. For a pregnant woman, the ideal antenatal visits are ideal. 12 टू, आइडियल कितनी है? 12 टू 14. Recommend the ideal visits every 7 months, one visit. हो गई 7. In 8th month, 2 visit. 9. In 9th month, every week. So it can go 9 months plus 7 days. So it's around how many visits? Ideal 12 से 14, 12 to 14. But if we talk about minimum, as per WHO, 8. 8 as per WHO, 8. Indian 4. Is that clear? Yes. So let's write. First of all, antenatal period में what you will do? Registration. है ना? That's why these antenatal visits. What is the main motive of these visits? And decrease the maternal mortality. Are you getting my point? Yes. That's why after having registration by ASHA or multi-purpose worker female, they are initiating what? During pregnancy vaccinations. इसीलिए तो neonatal tetanus क्या हुआ? कम हो गया. Are you getting my point? And we are doing this in order to detect the high risk pregnancies. What are the high risk pregnancies? Pregnancy में hypertension हो गया, diabetes हो गया, GDM हो गया. So because these pregnancy needs extra care because they can have a complications. So in order to detect these complications earlier or detect these conditions earlier, we are having what? Registrations. Okay. That's why these ideal antenatal visits are important. ठीक है ना? But in India, उल्टा ही होता है. First primary gravida, she will do how many USGs? She will do every month one because she is a primary gravida. If she is having second baby, she will hardly do how many? 2. If she is having the third baby, 1. चौथी वाली डायरेक्ट आती है डिलीवरी के दिन. Yeah, directly she will come. She will ask her, any test? No. Because they are getting used to it. Always see, when you will work in a OB-GYN, primary gravida will come with every month 1 USG. उसको बच्चा सो भी रहा होता है ना, वो हॉस्पिटल पहुंच जाती है, सो रहा है. प्रो प्लेयर्स, चौथा बच्चा, बच्चा हिलेगा भी नहीं ना, किसी को पता भी नहीं होता, वो आईयूडी लेके आते हैं, इंट्रायूट्राइन डेथ लेके आते हैं. ठीक है ना? व्हाट इज द मैटरनल मोर्टेलिटी गोल? गोल 70, लेस देन 70. बाय विच ईयर? 2030. What is the current maternal mortality rate? Huh? 97. Very good. What is the goal for IMR? 30. है ना? This was your question last exam. IMR और MMR का क्या पूछा था? गोल पूछा था. So it's 70, 30 by the year of 2030. Direct cause of MMR? Hemorrhage, you can say, PPH. Okay. Indirect cause? Anemia. Is that clear? Yes. और कुछ बताए? What is the difference between maternal mortality rate and ratio? और अगर लाइव बर्थ से डिनोमिनेटर में तो, और अगर क्या है डिनोमिनेटर में? रेट, रिप्रोडक्टिव. वेरी गुड. और कुछ? आगे बढ़ते. मल्टीप्लाइड पर हाउ मेनी बर्थ्स? 1 लाख. यही तो क्वेश्चन है. यही तो क्वेश्चन है. 1 लाख. व्हाट इज मैटरनल मोर्टेलिटी डिफाइंड एज? वन मोर एमसीक्यू. 42 वीक्स. 42 दिन तक. हाँ तो हिंदी में बताया कर. 42 days. That is how many weeks? 6 weeks. So from the day of conception until the 6 weeks, 42 days. It will be considered in what? Maternal mortality death. है ना? उसके बाद मरेगी तो नहीं, उसमें नहीं आता है. And also that one more question, truck accident हो गया तो that will not come. That is not included. ठीक है ना? चलो, write it down. Average visits are around 12 to 14. So every month. Till how many months? Till 7 months. Then every how many days? 15 days. In which month? 8th month. And every week in 9th month. Is that clear? Yes. Minimum 4 as per WHO 8. As per WHO 8. Clear हो गया? As per WHO how many visits? 8. ठीक है? First, remember how you do these 4 visits. Just remember 4 visits, okay? फर्स्ट सेकंड थर्ड फोर्थ ऐसा लगा लो, है ना, डिपेंडिंग अपॉन द वीक्स, फर्स्ट सेकंड थर्ड फोर्थ, मिनिमम हाउ मेनी विजिट्स, 4 विजिट्स। ठीक है, चलो। recent transmission of malaria can be calculated from recent malaria transmission. Yes, recent malaria transmission. B, infant parasite rate. चलो लेट्स डिस्कस अबाउट मलेरिया एवरीथिंग। ठीक है ना, मलेरिया वेरी इंपॉर्टेंट। पहले मैं पूछूंगा फिर मैं लिखूंगा, ठीक है ना। लेट आस्क बिकॉज यू ऑलरेडी नो दिस थिंग्स, रिकॉल। लिखना इज a 3 minute process. Now tell me, malaria is caused by Plasmodium falciparum, Plasmodium ovale, Plasmodium vivax and malariae. ठीक है ना। उसके बाद tell me what are the investigations or what are the tests you will do for a patient of malaria. सबसे पहले you will take a peripheral blood smear. How many? Thin and thin will tell me, thick will tell me confirmation of the disease. Done. उसके बाद we can also go the rapid diagnostic test which will detect the antigen, and the protein that it detects is called as histidine rich protein. Your NEET PG PYQ. Which protein? Histidine rich protein. Also we sometimes check which levels? LDH levels. Is that clear? This is the diagnosis of the malaria. उसके बाद now the main part from the malaria that they ask is going to be, अगर पैथो में पूछूंगा कौन सा ग्रैनुलोमा मैंने अभी बताया, I already told you about the granuloma linked with the malaria, Dirk granuloma. Which granuloma? One more important point from the patho is going to be it can cause an anemia. कौन सा वाला? Falciparum, banana shaped RBCs. Yes, it can cause anemia, falciparum. Now main thing is going to about treatment. Now if patient is having anemia due, if a patient is having malaria due to the Vivex, chloroquine is drug of choice in all states. Is that clear? If a patient is having a malaria due to falciparum, ACTL, ACT-SP. ACTL in northeastern state. What is ACTL? ACTL is lumefantrine plus prima, और वहां पे अदर्स में ACT-SP, sulfadoxine plus prima. हो गया? Now a pregnant lady is coming. If Vivex, chloroquine, all the trimesters. If falciparum, first trimester, quinine. Second trimester, if northeastern, ACTL, वहां पे ACT-SP. Is that clear? What are the prophylactic drugs you will give in the malaria? Doxycycline, mefloquine, atowacone. कब देंगे? 2 weeks prior to going to that state, 4 weeks post return. Is that clear? Yes, हो गया. This is going to be the treatment of malaria. अब drug जो इसमें बताई मैंने, chloroquine. What is the side effect of chloroquine? Bull's eye, and also causes QT prolongation, है ना. Bull's eye is a side effect of which drug? Chloroquine. Bull's neck कहाँ पे दिखता है? Diphtheria. Bull's neck is seen in bull cells on peripheral blood smear is a diagnosis of. बता दो. Thalassemia. Which condition? Thalassemia. Chipmunk faces है ना. Chipmunk faces in case of thalassemia. तो कौन सी सेल्स दिखती है? Bull cells on the peripheral blood smear. Is that clear? फिर thalassemia तो आपको पता ही है. Which index? Mentzer's index. Now if the score of Mentzer's index is less than 13, thalassemia. अगर more than 13 है, iron deficiency anemia. ठीक है ना. You have studied good. Trust yourself, believe yourself. ठीक है, बहुत सही है. इससे इससे बाहर नहीं पूछेगा. इससे बाहर पूछेगा बट वो 50-80 क्वेश्चन तो पूछेगा ना. बट मेन यही पूछना है. ठीक है. सो बी द बेस्ट थिंग यू कैन डू राइट नाउ इज बी कॉन्फिडेंट अबाउट योरसेल्फ. अब अभी तो लगता है ये भी नहीं पढ़ा है, वो भी नहीं पढ़ा है. अभी मैं पूछ रहा हूं तो आंसर कर रहे हो, बट मैं पूछूंगा नहीं ना, अंदर से लगेगा पता नहीं. मैंने तो वही पूछा है ना. मैं भी पास हुआ हूं, मैं भी पढ़ के आया हूं. कुछ नया तो नहीं पूछा ना. यही पूछते हैं मेन थिंग्स. Yes, there will be some twisted questions, but don't let those 80, 90 of twisted questions grab your potential and confidence. Chalo, indicators of now malaria. Now API, what is API? Annual parasite incidence. Sir, it's a number of, it says about number of new malaria cases, number of new malaria cases per 1000 population, per 1000 population. ठीक है? उसके बाद, what is the significance of this API? It tells us about active disease transmission. It tells us about active disease transmission. The infant parasite rate, it's the best indicator for recent malaria transmission. Then we have annual blood examination. It's the best indicator for operational efficiency of the worker. Slide positivity rate will tell me about the percentage of slides examined. So we have to remember all? No. Infant parasite rate and API. दो बार पूछा है, ठीक है ना? Now malaria topic, you can expect two questions. Treatment तो always there. Treatment is always there. Okay. Now agent बता दो. Plasmodium falciparum. Then ovale 5xn. ठीक है ना? Now tell me on peripheral blood exam, who will take the PBS? Who is taking the PBS? Who is taking the PBS? Multi-purpose worker, male at night knee, night filariasis, night filariasis at PHC, है ना? ऐसे चलो PBS examination, right? So peripheral blood smear. How many smear he will take? 2. Thin and thick. Thin and thick. Thin will tell me about species of malaria. Thick will tell me about confirmation of malaria. Then we have a rapid, it will be taken by multi-purpose worker male at PHC. Okay, this is a disease come under the program. Which program? National Vector. What are the disease coming under that? बताओ. Filariasis आता है, बता दो. Japanese encephalitis आता है, चिकनगुनिया आता है, डेंगू आता है. Okay, what they can ask is, they will ask you the question like this. See, question क्या होगा? Which of the following disease is not included under this logo? ऐसे पूछेंगे. Which of the following disease is not under which logo? This logo. ठीक है ना? What are the diseases? Remember, malaria, filariasis, Japanese encephalitis, dengue, and chikungunya. Malaria का causative agent plasmodium. Filariasis का which area? Bancroft and Bruggia. Your NEET PG recall question. Case of filariasis was given and it was mentioned that the causative agents has 2 nuclei at the tip of tail. Bruggia, Malai. अगर nuclei में tip नहीं है तो Bancrofti. How do you remember? देखो मैंने याद कैसे रखा. A and B. B is number 2. So 2 nuclei with what? Bruggia, Malai. ठीक है ना? After that, you do the test. एक तो peripheral blood smear at the night you will take, and you do what? Membrane filtration test. Okay. After that, you go with the treatment. There are triple drug therapy in this condition. What are the 3 drugs? What are the 3 drugs? एड, AID, A फॉर, अभी जो बोला, तो फिर ऐसे ही क्यों बताता है? ए एल्बेंडाजोल, आई उस टाइम जो बोले थे आई से, आइवरमेक्टिन, एंड डी डाइइथाइल कार्बामाजिन. इफ यू हैव टू चूज वन ड्रग, DEC यू चूज करना. बट अगर तीन लिखेंगे, तीनों एल्बेंडाजोल, आइवरमेक्टिन एंड filariasis is also more important. Leishmaniasis already discussed. Causative agent डोनोमनी ब्राजिलेंस है ना. ठीक है. लीशमेनिया का टेस्ट RK39 डिप्स्टिक टेस्ट और LD बॉडीज और लीशमेनिया टेस्ट. ड्रग ऑफ चॉइस लैम. जापानीज एनकेफेलाइटिस कॉजेटिव एजेंट विच ग्रुप? ग्रुप बी आर्बोवायरस. कम बैक टू द क्लास. ग्रुप बी आर्बोवायरस. ठीक है ना. एंड व्हाट इज द नेम ऑफ द वैक्सीन स्ट्रेन? नाकायामा एंड SA1414-2. ठीक है ना. डेंगी, व्हाट इज द कॉजेटिव एजेंट? dengue group virus, group B arbo. What are the tests you will do for dengue? Vidal for typhoid, Basu for typhoid. ये डेंगी है, बोन ब्रेक डिजीज, हड्डियां टूट जाती है पेशेंट की. Which antigen? NS1 antigen. Then, depending upon the complication, patient can have dengue hemorrhagic fever, then dengue hemorrhagic shock. है ना, पढ़ा होगा. उसके बाद, what are the tests we check? We check the platelet count, we check the hematocrit count, we go for the Tornic test, we go for the IgM by ELISA, and we go for the antigen NS1. ठीक है ना. What is the treatment in dengue? The give patients fluid and check for the platelet count because वो नीचे जा रहा है, rash होता है पेशेंट को, give supportive treatment and excessive fluids. And that's why fluid maintain करने के लिए you have to check the complication. Patient can fall to DHF and then DHS, dengue hemorrhagic fever and dengue hemorrhagic shock. Simple case of dengue was given and it was mentioned what, which of the following will prevent the warning signs? Warning sign मतलब patient shock में जा रहा है, तो IV fluids. You keep, what is the first thing you tell to the patient of dengue? Drink more water. Is that clear? So that's all about dengue. Last one, chikungunya. बता दो. What is the agent? Group? इस टाइम बी मत बताओ, इस टाइम ए बताओ. तो ग्रुप ए हर्बोवायरस. इज दैट चिकनगुनिया के लिए इतना याद रखो. बट मेन मलेरिया, फिलेरियसिस, लीशमैनियसिस, जापानीज एंड डेंगी, all are very important. If I need to choose three, I will choose malaria, filariasis and dengue. इनको पढ़ के जाए. रिसेंट वो वन केस आ जाता है, वो उतना नहीं है. बट मेन इंपॉर्टेंट इज व्हाट? मलेरिया एक ही टॉपिक है. सो व्हाट आर यू एक्सपेक्टिंग? हाउ मेनी क्वेश्चंस? 2 or 3 क्वेश्चंस. ओके. बट उसमें से भी क्या पूछेगा? इंपॉर्टेंट. अब मलेरिया वो कभी छोड़ता नहीं. अब कॉमन सेंस लगाओ, दूसरा कहां से बनाना है क्वेश्चन. ओके. यू नीड टू प्रिपेयर दिस क्वेश्चंस. चलो, दिस इज ऑल अबाउट व्हाट? नेशनल वेक्टर डिजीज कंट्रोल प्रोग्राम. सारी डिजीज रिकॉल हो गई, माइक्रो पॉइंट ऑफ व्यू एज वेल एंड एज पर द PSM point of view. Chalo. Now, rapid diagnostic kit, sir, we have RDT, rapid diagnostic kit. Okay, this will be uploaded in your app. 2x speed पे watch करना जब PSM revise करोगे. ठीक है ना. Watch at 2x speed. At least कान में जाना चाहिए. और either when you have this PDF, इसको ना एक बार recall करना, because all the things we are not able to write. अगर वो सारी चीजें लिखेंगे तो it will take a long time. But अब जो verbally बता रहा हूँ, try to remember all these things because this is all the shortcut of all the topics. अब टॉपिक को पढ़ने के लिए सिम्टम्स, रिस्क फैक्टर्स, ये ट्रीटमेंट, बट मैं उतना ही बोल रहा हूँ जितने में क्या हो सकता है क्वेश्चंस. रैपिड डायग्नोस्टिक किट, इट इज एन एंटीजन डिटेक्टेड किट. अगेन एन इंपॉर्टेंट क्वेश्चन सर. विच प्रोटीन? NS1 तो उसमें होता है हिस्टिडीन, रिच प्रोटीन. वेरी गुड सर. हिस्टिडीन रिच प्रोटीन. इज दैट क्लियर? HRP2 आता है. और उसमें कौन सी लेवल चेक करते हैं हम? We also check, sir, LDH levels. We also check LDH levels. Okay. Now the treatment. Remember which drug is contraindicated in pregnancy? Primaquine नहीं देते हैं. Primaquine is contraindicated in pregnancy. And can we use the treatment जो मैंने prophylaxis के लिए बताया? Can we use that as a main treatment? No. उनमें से कोई भी drug we don't use for what? Main treatment. Okay. Now northeastern states, sir, we have ACTL, where A stands for artemether, L stands for ल्यूमिफेंट्रिन एंड प्लस प्राइमाक्विन देते हैं. प्लस प्राइमाक्विन, ACTL प्लस P. ऐसे याद रखो, ACTL प्लस P. Other conditions we have ACTSP. We have artesunate plus sulfur toxin plus prima plus primaquine plus primaquine. Is that clear? And remember, if a patient is having malaria during the pregnancy, if a patient is having malaria during the pregnancy, so if it is, पहले यहाँ पे याद रखना treatment में, this is for Plasmodium falciparum. If Plasmodium vivax, then what is the drug of choice? क्लोरोक्विन. क्लोरोक्विन का साइड इफेक्ट वंस मोर, बुल्स आई मैकुलोपैथी. ठीक है ना. बुल्स नेक किस में बोला था मैंने? डिप्थीरिया में. विच मेम्ब्रेन? सीडो व्हाइटिश मेम्ब्रेन. क्वेश्चन आएगा, व्हाट इज द मीडिया? लॉफलर्स मीडिया. व्हाट इज द नेम ऑफ द टेस्ट? यस, वेरी गुड. एलिक्स टेस्ट. एंड व्हाट इज द ड्रग ऑफ चॉइस? अजिथ्रोमाइसिन और एरिथ्रोमाइसिन. ठीक है ना, मैक्रोलाइट्स में यूज करते हैं. ठीक है ना. बुल्स नेक. चलो, वाइवेक्स के लिए क्लोरोक्विन, एंड इट आल्सो कॉजेज व्हाट? क्यूटी प्रोलॉन्गेशन. है ना, क्यूटी प्रोलॉन्गेशन. नाउ मलेरिया विद प्रेगनेंसी, सर इफ इट इज प्लाज्मोडियम वाइवेक्स, I can use chloroquine for all trimesters. Is that clear? For all trimesters, I can use chloroquine. But if a patient is having Plasmodium falciparum, if it is Plasmodium falciparum, sir, first trimester, what is the drug of choice? Quinine. What is the drug of choice, bacho? Quinine. Sir, second and third trimester, if northeastern, ACTL. If other, ACTSP. Is that clear? ACTSP. Second and third trimester, depending upon what? If northeastern and other. Contraindicated क्या है? Contraindicated is going to be your primaquine. So here, now prophylaxis of malaria. We have a short prophylaxis and a long prophylaxis. You just remember the whole prophylaxis. So 2 weeks prior and post return 4 weeks. जो doxycycline है, we use it in short, and mefloquine we use in long. Okay? ये तो पूरा ही वो मेन क्लास का हो गया. 2 weeks till 4 weeks post return. ठीक है? What are the 3 drugs? Doxycycline. Next, mefloquine and atowacone. Is that clear? Is that clear? Doxy में S लिख रहा हूं मतलब short, meflo में L लिख रहा हूं मतलब long. Short and long. Short and long. Clear? Next. Online people. आज ये शांत है ये ऑनलाइन वाले. हाँ हाँ चलो. Because I've already revised full PSM on MedHub, okay? वहाँ पे already revision हुआ. 2 weeks back. चलो. Which of the following options best defines the correct sequence of the phase of the demography cycle? This was a NEET PG recall, direct. पूछा था, what is the sequence of what? Demographic cycle. So what is the sequence, guys? Yes? B, high stationary, early expanding, late expanding, low stationary, and declining. Is that clear? Chalo. Simple question was asked this exam. Now, in case of high stationary, what will be the birth rate? Very high. Okay, death rate? Both are high. When both are at the equal pace, high, what will be the population? Stationary. Okay. In early expansion, birth rate is high, but the death rate starts to it starts to decline. Eventually, what will happen to the population? It will start increasing. It will start increasing. Birth rate, it starts declining. Death rate, it will further decrease comparatively to the above one. Continue decline. Population का क्या होगा? Increase, but slow rate. It will increase, but slow rate. Low stationary, both are low. Very low, very low, and the population will be stationary. Reversal में or reversal or declining, okay? Almost zero. And the death will be natural deaths. What will happen to the population? It will be decreasing. Is that clear? Okay. Simple question was asked. India is in which stage? थर्ड. लेट एक्सपैंडिंग है ना, पहले ये पूछा था, उसके बाद लास्ट टाइम पूछा था, अभी नीट पीजी में क्या पूछा है? सीक्वेंस. ओके, दीज डेज दे आस्क सीक्वेंस. नीट पीजी में ये सीक्वेंस भी पूछा था डिजास्टर साइकिल की. दैट क्वेश्चन आई हैव ऑलरेडी इंक्लूडेड. ऑल द क्वेश्चंस दैट हैव बीन आस्क्ड इन द रीसेंट नीट पीजी एग्जाम्स, वही टॉपिक्स वी आर डिस्कसिंग. ठीक है, चलो. Epidemiology is epidemiology is the study and the analysis of the distribution, pattern, and determinants of health, disease, condition in defined population. Which among the following correctly defines your generation time? Bata do. What will be the answer? Which of the following will continue? Yes, yes, B. So definitions are very, very important. So first of all, if I talk about interval between the marriage and the birth of child, you have studied phases of the family cycle, है ना? From marriage to the birth of child, formation, है ना? तो क्या है? Entry interval between marriage and birth of child is formation. Okay, formation के बाद extension, ठीक है ना? From first child to second child. चलो, तो first में क्या आएगा? Formation. Interval between primary and secondary cases called as which interval? Serial interval. Entry of organism to the symptom of disease is going to be incubation period. Okay, first case of the disease is primary case. First reported case of the disease is index case. Case developed from the contact of a primary case is secondary case. Entry of an organism to the detectable antibody present is window period. Entry of an organism to the maximum infectivity is a generation time. So let's recall all these definitions. Equation to definition से आता ही है. Interval between marriage and this is called as formation. Interval between entry of organisms and the maximum infective is called as generation time. Interval between primary and secondary case is called as serial interval. Interval between the entry of infection and the symptom of diseases. Interval between the entry of infection to detectable antibody present is window period. Now, two definitions that they usually ask is going to be quarantine and isolation. What is quarantine? जिसकी डिजीज ना हो उसको बंद करेंगे. Quarantine is separation of a healthy or suspected person till the incubation period, and isolation is separation of diseased person till the period of communicability. Is that clear? So that is isolation. So right, quarantine, separation of which person? मैंने भी disease ही लिखा दिया. Separation of healthy or suspected till the incubation period, till the maximum incubation period. This is separation of diseased person till period of infectivity or period of communicability, POC. ठीक है ना? Next, what other definitions I discussed? Primary case, first case of the disease. Secondary case, case developed from the contact of primary case. And first reported case is going to be index case. Is that clear? These all definitions. Phases of family cycle, वो तो पता ही है तुम्हें. Complete dissolution, incomplete extension, formation. Phases of family cycle. Any definition? Window period, antibody detectable. ठीक है? Let's next. Following are the primary signs in WHO classification of xerophthalmia except. Following are the बता दो. What is the answer? A, B, C, D. It is B. XN, night blindness. ठीक है ना? Now, see, primary में क्या आता है? X1A, X1B, bytots and all. Secondary में आता है XN, secondary feature. So let's discuss about vitamin A things. Okay. Now tell me, vitamin A deficiency causes xerophthalmia. First symptom is, first clinical symptom is bytots spot. Now, how much vitamin A you will give to a patient coming with a vitamin A deficiency? If less than 6 months, 1 year, more than 1 year, if the weight of the baby is less than 8 kg, 1 lakh international units. Richest source and vegetable is carrot. What is the investigation of choice? Which levels you will check? Which levels you will check for investigation? Serum retinol levels. Which levels? Serum retinol levels. And then this vitamin A, tretinoin, isotretinoin, it's a drug of choice for acne. But what will be the side effect in pregnancy? Cleft lip and cleft palate. That's why it's advised, depending upon which way you are taking, oral, topical, before 3 months, 6 months before the conceive. Is that clear? Because they have a very strong teratogenic effects. Is that clear? Let's write about vitamin A. Let's discuss all the vitamins. Can we be a bit faster in vitamins? Yes. Speed is okay now? Yes. But vitamins very repeatedly asked, but we cannot even skip. You know? Chalo, deficiency of vitamin A will cause xerophthalmia. So now WH have a primary signs. What are the primary signs we have? First of all, so we have X1A. X1A is going to be conjunctival xerosis, right? Conjunctival xerosis. Then X1B is going to be bytots spot. Okay, then X2, corneal xerosis. Then X3A, yes, corneal ulcer or scar. Then X3B, kerato Malaysia. X1B is kerato Malaysia. ठीक है ना? X1B is kerato Malaysia. Now all of these primary features are reversible except X3B, kerato Malaysia. इसलिए मैंने लाल में लिखा है. It can cause absolute blindness. ठीक है ना? X3B, kerato Malaysia. ठीक है? Now secondary features, N with night blindness, except with xerophthalmic fundus. F with xerophthalmic fundus, and XX with xerophthalmic scar. The first symptom is going to be night blindness. The first sign is going to be, no, first sign zero conjunctival xerosis लिख दो, ठीक है ना? Conjunctival xerosis. Most common clinical sign for screening: Bitorts, spots. Most sensitive screening test: which levels? Serum, retinol levels. Very good. Sources: animal richest sources: halibut oil. Vegetable: carrot. Fruits में second richest liver oil. ठीक हो गया? That's it. Next, this is, you can see sea tide wave appearance, xerophthalmic fundus, xerosis, and this is going to be second one, Bitorts, spots, and this is going to be your X1B, Bitorts, spot. Okay. Now prophylaxis. Total, how many doses we have? Total amount. First dose you will give 9 to 12 months. ठीक है ना? 9 mainly. ठीक है ना? But अगर deficiency हुई less than 6 months, then you have to give accordingly. ठीक है ना? And 2 to 9 dose every 6 months. Question was asked. Every 6 months. IV, IM, oral. ये याद रखना. कैसे देते हैं? Orally. Is that clear? Now dosage less than 6 months. 50,000 international units. 6 to 12 months. International unit. More than 1 year. 2 lakh international. If weight is less than 8 kg. This was the question asked. It was, weight was given 7.5 kg. Age was given 14 months. But again, your answer is going to be 1 lakh international units. Chalo. Vitamin B complex. Vitamin B causes beriberi. But in alcoholics, alcoholic-induced neurocognitive syndromes, you have Wernicke's encephalopathy and Korsakoff's psychosis. Wernicke's encephalopathy, you remember with the triad GOA. What is that? Goa. What is G? Global confusion. What is G? Global confusion. What is O? Ophthalmoplegia. What is O? Ophthalmoplegia. What is A? Ataxia. What is A? Ataxia. Okay, how do you remember? How do you remember the Korsakoff psychosis? Patient will have confabulation. Patient will have confabulation and retrograde amnesia. And retrograde amnesia. What will be the treatment for these two conditions, Bacho? Thiamine. What will be the treatment? Thiamine. IV, thiamine, and glucose. NEET PG question was asked whether you will give glucose first or thiamine. If we give glucose first, metabolize होके further decrease करेगा which levels? Thiamine levels. और thiamine जब ज्यादा कम होगा तो patient को क्या होगा ज्यादा? Global confusion, ophthalmoplegia, and ataxia. Is that clear? Yes. And it is seen with usually which people? वो तो ये होगा. मतलब vitamin B1 deficiency overall किन में दिखती है? Polished rice eaters. Now what you can advise them? Parboiling of the rice. Is that clear? Clear हो गया? Yes. Come to second. Riboflavin. B2. What is a triad? It causes a riboflavinosis, having a triad of teleosis, angular stomatitis, and glossitis or geographic tongue. ठीक है ना? लिखो पहले. Deficiency will cause. Deficiency will cause online people. Yes. Deficiency will cause berry. So this thiamine deficiency is seen with polished rice eaters. Laryngospasm, your recent question. Which vitamin deficiency? D. Laryngismus stridulus. है ना? विच विटामिन डेफिशिएंसी? डी. यस, रिलेशन विद द कैल्शियम, ठीक है ना. विटामिन डी, कैल्शियम एंड पीटीएच ऑलवेज हैव व्हाट? रिलेशन इन बिटवीन. ओके, ठीक है. beriberi, deficiency causes beriberi in alcoholics. They will cause two conditions: Wernicke's encephalopathy. What is the triad बच्चों? You know गोवा, जगह का नाम नहीं, GOA, ठीक है ना. ग्लोबल कंफ्यूजन, ऑप्थेल्मोप्लेजिया, एटेक्शिया. सेकंड वन इज कॉर्सेकॉफ्स साइकोसिस. क्या दो चीजें याद रखोगे? कॉन्फैबुलेशन एंड गजनी, रेट्रोग्रेड एमनीजिया. सर व्हाट इज द ट्रीटमेंट? मैं ऐसे लिख रहा हूं वन, इसका मतलब फर्स्ट क्या दोगे? आईवी थायामीन प्लस, उसके बाद क्या दोगे? ग्लूकोज. इज दैट क्लियर? प्रिवेंशन, पार बॉइलिंग ऑफ राइस, या अल्कोहल ही मत पियो, ठीक है ना. चलो, राइबोफ्लेविन डेफिशिएंसी विल कॉज a riboflavinosis. Okay, we have a triad of cheliosis, then angular stomatitis, then atrophic glossitis और glossitis. क्या बोलते हैं उसको? और yes, geographic tongue. Is that clear? चलो, niacin. नियासिन डेफिशिएंसी होगी तो मतलब कौन सा अमीनो एसिड कम होगा? ट्रिप्टोफैन. तो ट्रिप्टोफैन से क्या क्या आता है? यस, मेलेटोनिन, सेरोटोनिन एंड नियासिन, ठीक है ना. तो how much of niacin is used to produce, how much of tryptophan is used to produce niacin? 60 mg of 60 mg of what? Tryptophan or niacin? To produce niacin. This is again the question. How much tryptophan is used? Okay, now tryptophan deficiency is coming. Yes, now you might know tryptophan से और क्या आता है? Melatonin is which hormone? That's why the drugs like tryptomer is coming for what? Sleeping. Because trypto कहाँ से आता है? Tryptomer. Z drugs है ना, zolpidem वे कहाँ से आता है? Tryptophan से. Tryptophan is for sleeping. Melatonin, ठीक है ना. Serotonin you already know, carcinoid syndrome. And next one is going to be your niacin. For niacin you already know, ठीक है. Niacin has a one more property. Anyone? जल्दी बता दो. नीट पीजी रिकॉल. हर, हाँ तो क्या करेगा? बस सही है, बढ़िया. हाइपर कोलेस्ट्रॉल में, ठीक है ना. ठीक है, याद रखा. आगे बढ़ो. डेफिशिएंसी will cause pellagra. How many D's? 6 D's. What are the 6 D's? Dementia, diarrhea, dermatitis, delirium. नहीं, पहले उसको डिप्रेशन करेंगे. डिप्रेशन, उसके बाद डेथ, ठीक है ना. 6 D's. Now this केसल नेक, that is what you have a tryptophan deficiency, ठीक है ना. और niacin deficiency. if they will if they will give this image and ask you which amino acid is decreased, क्या will be your answer? Tryptophan. क्या होगा आंसर? Tryptophan. Rather niacin, niacin आता कहां से है? Tryptophan से. So you will mark tryptophan deficiency. Tyrosine से क्या आता है? ठीक है, ठीक है, ठीक है. पहला क्या बोला? Melanin. Melanin is used for Pigmentation of the skin. If melanin is absent, what is the diagnosis? Albinism. What is your deficient hormone? Tyrosinase. Don't mark tyrosin kinase, tyrosin hydroxylase. याद के रखो tyrosin. दूसरा क्या आता है वहां से? कैटेकोलामाइंस. एपिनेफ्रिन, नॉन एपिनेफ्रिन. किस कौन सा ट्यूमर एसोसिएटेड है? फियोक्रोमोसाइटोमा. फियोक्रोमोसाइटोमा इज अ ट्यूमर ऑफ एड्रिनल medulla. Particularly which cells? Chromaffin cells. Then depending upon the condition, patient will have a palpitation, sweating and headache. It's a classical diagnosis of pheochromocytoma. If on pathology we have a classical pattern of the cells called as which pattern? Zella-Bellin pattern. And then if we talk about the treatment of a investigation of pheochromocytoma, we can check a VMA levels, but investigation of choice is going to be metanephrine levels. Is that clear? Drugs before the surgery: phenoxybenzamine; during the surgery, phencholamine; after the surgery, labetal. Pheochromocytoma clear? फिर थायराइड का, थायराइड में T3, T4, TSH. प्रेगनेंसी में फर्स्ट ट्राइमेस्टर हाइपरथायरॉइडिज्म, PTU. सेकंड एंड थर्ड कार्बेमाजोल, मेथेमाजोल. Why not in first trimester? It can causes aplasia cutis or cutis aplasia. What is that? Absence of dermis and epidermis. Thyroid related disorders. Remember one thing: which thyroid cancer have amyloidosis? Medullary thyroid cancer. Question number one: which thyroid have a marker as calcitonin? Medullary thyroid. Question number two: which thyroid cannot be differentiated with FNAC? Follicular. Question number four: which thyroid is seen in young? Papillary. Question number five: radiation exposure. Question number six: anti-TPO. Hashimoto's. Earthly cells. Hashimoto's thyroidites, है ना? Earthly cells, Hashimoto's, and other overall marker is thyroglobulin. इसके बाहर कुछ नहीं आएगा. अगर आया क्या कर सकते हैं? नोट्स में क्या है? हाँ वो तो आएगा ना 5.0. फिर आज क्या चल रहा है? 5.0 हमारा तो. मतलब हम ही बुढ़े हो गए हैं. हमारा तो 1.0 ही है. चलो पेंटोथेनिक एसिड. चलो चलो चलो, एग्जाम 12 जैन को आ रहा है भाई. रिवाइज टायरोसिन से क्या आ रहा है, ट्रिप्टोफैन से क्या आ रहा है? ऑल आर इंपॉर्टेंट, ट्रस्ट मी. प्योक्रोमोसाइटोमा, ये सब भी जो मैं बता रहा हूं ना, इसको चिल मत समझो. ये सारा इंपॉर्टेंट है, ठीक है? ट्रस्ट मी. है ना? एग्जाम के बाद रिकॉर्डिंग सुन लेना क्या क्या मैंने बोला था. यू कैन टैली कितने नंबर आए थे. ठीक है? सारा सारा इंपॉर्टेंट है. पेंटोथेनिक एसिड इज B5. क्या करता है? बर्निंग फीट सिंड्रोम और सोल सिंड्रोम. बर्निंग फीट सिंड्रोम और सोल. सोल नहीं लिखना, रूह को नहीं जलाता, पैरों को जलाता है. सोल सिंड्रोम. चलो नेक्स्ट. पायरोडॉक्सिन, विटामिन B6. ठीक ना? डेफिशिएंसी विल कॉज पेरिफेरल न्यूरो एंड एंड yes, which anemia? Yes, which anemia? It can cause sideroblastic anemia. Okay. Now side effect of a which drug? ISO. Yeah, that's why a patient taking anti-TB drugs, we are advising take 10 mg isoniazid as well. ठीक है ना? B7 biotin deficiency will cause alopecia, hair loss. अब मैं डर्मा में जाऊंगा नहीं, but yes, you can remember alopecia areata, exclamatory sign, patchy hair loss, and drug of choice is minoxidil, 2% in female, 5% in males, and also we use a one drug 5-alpha reductase inhibitor called as finasteride. Is that clear? The same drug which shrinks the size of a prostate in benign prostate hyperplasia. ठीक है ना? बायोटिन. बाकी नेल्स वेल्स स्किन के लिए भी अच्छा है, बट एलोपेशिया याद रख लो. Folic acid B9 deficiency will cause पहले megaloblastic. It will cause, sir, megaloblastic anemia. Very good. So this megaloblastic anemia can be also caused by the which B12. But in pregnancy, मैं थक गया ये न्यूरल ट्यूब बोलते बोलते. It will cause neural tube defect. Okay, and this neural tube defect, no further discussion. बहुत हो गया. B12. B12 will cause cyanocobalamin. Deficiency will cause megaloblastic anemia, sir. Sir, this will also be seen in strict vegetables, vegetarians. ठीक है ना? And it can also cause what? Subacute degeneration of myelin. Because this vitamin B12 is used to make the myelin sheath. Okay? अब B12 नहीं होगा तो pulses बढ़ेंगे नहीं आगे. Now tell me the patient, two patients are coming to you with one patient is coming to you with a diagnosis of megaloblastic anemia. What will be the clinical features? You can differentiate it with what? That is the investigation you will do. Clinical feature में. If neurological deficit features, that goes with the B12. अगर नहीं है तो B9. Simple thing. Yes. Yeah. Cerebral features are associated with what? B12. Because B12 cause subacute degeneration of myelin. And investigation, you can go MMA levels and homocysteine levels. If both are elevated, if one is normal, another is elevated. Is that clear? B9 हो गया. This is going to be your spina bifida. है ना? कौन सी साइन लिखती है? Lemon and banana sign. The most common spina bifida is going to be spina bifida occulta. Spina bifida occulta. ठीक हो गया? Done? चलो next. Sir, vitamin C deficiency will cause scurvy and gum bleeding and very good delayed wound healing. अगर minerals की बात की जाए कौन सा करता है? Zinc. Very good. Richest sources आमला. क्या बोलते हैं? और इंडियन गूस berry. Now this is about the twisting things. You all know vitamins on your finger tips, है ना? Everyone knows. But फिर वो पूछते क्या है? Laryngismus stridulus, है ना? वो क्या पूछते फिर? Laryngismus stridulus. अब तुम लोगों को पता है वो क्यों? क्योंकि उन्होंने पूछा था. They asked. बट आगे क्या पूछेंगे वो 7.0 में पता चलेगा हमें. Okay? Now you can see this is what? Scurvy. Okay, gum hypertrophy is caused by which drug? Penetrine. है ना? Gum hypertrophy or gingivitis. It's also caused by one more drug. One more other drugs causes gingivitis. Tetracyclines also cause what? Gum hypertrophy. ठीक है ना? And which drug? Penetrine. चलो. और गम में एक चीज मैं इंटीग्रेट करता हूँ. हाँ, स्ट्रॉबेरी गम्स. वैगनर्स ग्रैनुलोमेटोसिस. विच एन का? CN का. वर्ल्ड कप को याद रखना. वेजनर्स फॉर CN का. ठीक है ना? साइक्लोफॉस्फामाइड. Treatment, yes. Treatment, okay. Treatment is cyclo. But what is the side effect of cyclophosphamide? Hemorrhagic cystitis. What is the drug of choice for hemorrhagic cystitis? Mesna. Very good. चलो जहां भी इंटीग्रेट मिले कर लो. Vitamin D. Laryngismus stridulus, you already know. Now vitamin D has form. We have vitamin D1, D2, D3, D4, and D5. But D2 and D3 is called as important. While more is D3, cholecalciferol, which is also an active form, 1,2,5 dihydroxycholecalciferol. Now this vitamin D, natural sources, richest sun, but वैसे halibut oil. Again, for the vitamin D, if in kids, what will happen? Rickets. If in adults, osteomalacia and osteoporosis. Osteoporosis भी हमने पूरा डिस्कस किया. लिखो मोस्ट एक्टिव फॉर्म. Cholecalciferol. In children, sir, it will cause rickets. Verum or valgum? Varum. Verum or valgum? Varum. Rickets में. ठीक है ना? In adults, osteoporosis. Bone formation cells are osteoclast or blast. Which one? Now, which drug in osteoporosis will directly act on this osteoclast? Which one? Teriparatide. Very nice, very nice. Excellent. Richest source. Yes. Halibut oil, right now? Richest source is halibut oil. Rickets. चलो. Vitamin E tocopherol. अब तुम लिखो vitamin E tocopherol. What vitamin E deficiency causes? Vitamin E deficiency causes hemolytic disease in newborn. And vitamin E has a great property. What is that called as? Antioxidant. So most potent vitamin having antioxidant properties, vitamin E. Okay. Now deficiency of vitamin E will cause hemolytic disease in newborn. Hemolytic disease in newborn. And hemorrhagic disease in newborn will cause by vitamin K. Vitamin K. So लिख दो. Richest sources halibut oil. Vitamin E has a which property, बच्चों? Antioxidant property. Sir, the richest source is wheat oil. Wheat. The deficiency will cause hemolytic disease in newborn. Which vitamin deficiency can cause ophthalmoplegia? B1 नहीं है. Which vitamin deficiency can cause ophthalmoplegia? वो तो अल्कोहलिक B1 नहीं, वो नहीं है. ब्रेक में बता देना. चलो कुछ तो काम रखे तुम लोगों के लिए. Vitamin K deficiency will cause hemorrhagic disease in born. ठीक है ना. ना मुझे बताओ पेशेंट क्वेश्चन वाज गिवन दैट मदर वाज फीडिंग अ बेबी ब्रेस्ट मिल्क व्हिच विटामिन विल बी डेफिशिएंट. अरे के विटामिन के है ना. हाँ. सी फॉर काउ, सी फॉर काउ मिल्क. विटामिन सी इज डेफिशिएंट इन काउ मिल्क. सी फॉर काउ, सी फॉर विटामिन सी. ऐसे याद रखो. विटामिन के इज डेफिशिएंट इन ब्रेस्ट मिल्क. ठीक है ना. याद रखा है ना. यस. व्हाट इज ब्रेस्ट मिल्क हैविंग अ वेरी essential fatty acid which will help in the brain development called as DHA, docosahexaenoic acid. But along with that, there are more two things present in the breast milk which helps in the brain development. CT, cysteine and taurine. Cysteine and taurine. ठीक है ना. चलो लिखो अब. Natural form is fat soluble or water soluble? Fat soluble. K1 is called as क्या? Phylloquinone. K2 is called as menaquinone. Okay. And synthetic form is water soluble. And K3 is menadione. It can cause bleeding disorders and come bleeding in the infants and adults. Is that clear? Yes. Now zinc. Selenium deficiency. What is our diagnosis? What is your diagnosis? Acrodermatitis enteropathica. Acrodermatitis enteropathica. Selenium deficiency will cause Cations cardiomyopathy. अगर अगर सेलेनियम ज्यादा होगा तो केशन बैक डिजीज. तो क्या होगा? केशन बैक डिजीज. जिंक डेफिशिएंसी विल कॉज डिलेड वुंड हीलिंग. इन्फेंट्स में क्या करेगा? एक्रोडर्मेटाइटिस enteropathica. Treatment is zinc supplementation. Is that clear? Yes. Now next और एक है फ्लोरीन. फ्लोरीन के बारे में बताओ. अगर फ्लोरीन कम है dental caries. If fluorine is more, dental fluorosis followed by skeletal fluorosis followed by crippling. What is the more than 10 is crippling? Your FMG MCQ. अभी पीछे बता. More than 10 is crippling. Up till 6 is skeletal. More than 3.0 is your dental fluorosis. Okay. इमेज पूछी थी डेंटल फ्लोरोसिस की, मोस्ट ऑफ स्टूडेंट मार्क्स स्कर्वी। हमेशा दांत दिखाएंगे तो इट डजंट मीन स्कर्वी इज देयर, है ना। दांत दिखाएंगे तो yellowish discoloration on the teeth, that is going to be dental fluorosis. Now what is the treatment you will tell the patient to have a dental caries fluoride containing toothpaste? अब अगर डेंट फ्लोरीन ज्यादा है, so you go with a technique called as Nalgonda technique. You add three things: lime, element, B से बाइकार्बोनेट, ब्लीचिंग पाउडर बाइकार्बोनेट वही होता है, ठीक है ना, BAL. व्हाट इज द टेक्निक कॉल्ड एज? नालगोंडा टेक्निक. एम आई फास्ट? ऑल ओके? ऑनलाइन पीपल आज भूल ही गए ये. ऑल गुड गाइस? आर यू देयर लिसनिंग? ऑल गुड एवरीवन? आर यू एबल टू कैच वट एवर आई एम स्पीकिंग? Yes, you guys have all studied this. Yes, it's all there in your PSM notes, everything, okay? As well as integrated notes. They all have these integrated notes. Yes. Anything new coming up? चलो, तो फ्लोरीन में कौन सी टेक्निक? नालगोंडा टेक्निक, है ना. एंड अगर फ्लोरीन कम है तो फ्लोरीन कंटेनिंग टूथपेस्ट, ठीक है ना. एंड लाइम एलम वो उसमें यूज करते हैं नालगोंडा टेक्निक में. सर प्लीज टेक पैथो आर दैट्स कमिंग अप, नॉट हियर, समवेयर एल्स. ठीक है, मैं भी लाइक करता हूँ. ब्रेक? वी आर स्टडिंग एट द स्पीड ऑफ 180. हम ब्रेक देंगे तो ब्रेक फेल हो सकता है. अबे इंजन 2000 सीसी का है. चलो, टेल मी आंसर, व्हाट विल बी द क्लोरीन कंटेंट फॉर ड्रिंकिंग वाटर सर? आंसर. And tell me all the mechanisms you use for ox separates for free residual chlorine, है ना, पढ़ा है ना. Tell me about this. Tell me. Okay, I'll be discussing this as well. Chalo, let's discuss this one, okay, and then I'll give break, okay, fast. A patient with a three hypopigmented anesthetic patch with a one thickened nerve present to your OPD, what shall be your treatment? Less than 5 lesions are there, it's a case of a paucibacillary. So treatment will be for 6 months. How many drugs? 3 drugs. What are the 3 drugs? Dapsone, rifampicin, and clofazimine. Is that clear? Strongest drug, rifampicin. Now, sir, this leprosy treatment, 6 months for paucibacillary, 12 months for 0 to 5 lesions, more than 5. Then we have classification called as Wrigley-Jones classification, RGC, है ना, RJC classification, ठीक है. But what is important is the drug regimes and satellite lesion is seen in BT type of leprosy. और किस में दिखता है? Cat scratch disease में, ठीक है ना. चलो लिखते हैं आफ्टर ब्रेक. अब गाड़ी रुक गई. ओके, टेक ए ब्रेक ऑफ 10-15 मिनट्स, कम बैक. मैं रात तक पकड़ूंगा, टेंशन ना ले. ओके, चलो गाइस, हैव अ ब्रेक, देन वी स्टार्ट अगेन. याद आ रहा है सब कुछ? फार्मा का रैपिड फायर खेलते बाद में लास्ट में, ठीक है. हाँ? तो फार्मा पढ़ के कभी स्ट्रांग नहीं होगा लाइफ में. नहीं, नो नो, ड्रग ऑफ चॉइस नहीं पूछते.